Federal officials have selected Wake County as the location for a survey which captures a snapshot of the well-being of the United States. The National Health and Nutrition Examination Survey, or NHanes for short, will take place throughout this fall. And residents from all walks of life from many parts of the county will be asked to participate.
The NHanes survey is very important to the U.S. population. It's really the only way that we have to take a snapshot of the health of the U.S. population. And this data is then used by the policymakers for future prevention programs, for how they're going to spend money in the next few years. It's all based upon looking at the health status of the U.S. population, which we at the CDC collect. Wake County was selected to represent every other county that has demographics just like it. Actually, it's a random process. Every county in the United States is divided into 15 groups, and then there's basically one almost like out of a hat, there's one county that's chosen, and Wake County was chosen this year to represent every other county just like it. What we do is a couple weeks before we begin the survey here in the county, we have sent out an advance letter that says that you may be visited by a health representative and gives some information. It also talks about our CDC badges, because all of our folks will have CDC badges on. Then the next step is if you have a knock on the door from one of our health representatives, and at that point they will introduce themselves, and there's about it takes only about 3 minutes to do a demographic screener. And that's just asking you about how many people live in your household and the demographics of those folks that live there. And all the information that you give us is confidential. The next step that happens is we enter that data into a computer, and there's an algorithm already entered into this computer that will select somebody or not. So maybe one or two, everybody, nobody may be selected in your household. If you're selected, then the interviewer then talk to you more about what NHanes is and what your opportunities may be with NHanes. NHanes actually is based upon a scientific random sample. So from the very beginning, where we randomly choose the county to we randomly choose addresses, we randomly choose participants. And that means that we do not accept volunteers. We're trying to mimic the U.S. population, and in order to do that, we have to stick with what our little pen tops either choose or select or not select in a household. So what that means is that if you choose not to participate, we cannot have your neighbor step in. We cannot go and have somebody down the street take your place. And basically what we've done is we've actually lost the data for, you may stand for anywhere 35 to 50,000 people your data may represent. So we actually lose that amount of data when you choose not to participate.
The individuals that are selected will benefit from being able to have their baseline health measures, and therefore I think that's an extreme benefit to them, because the cost of these various tests are extremely high, and so they will have those free baseline measures that they can use for their own benefit. From a population health perspective, again, I'll say that it does reinforce the fact that much of the funding and many of the program decisions are based on what those measures are. So I think from that perspective, that's going to be an extreme benefit to Wake County.
Well, we are hoping that if you're selected to participate, that you do choose to participate. If you would like additional information, feel free to go to cdc.gov/NHanes for additional information. Your chances are very low of actually being selected, so we really appreciate your time, and thank you for your time.
We would encourage anyone that is asked to participate to please be a willing participant in this effort, because not only will it benefit you individually if you're selected for this process, but it will benefit us as a county, a region, and nationally it will benefit us.